Hello everyone, welcome back to the Medi Queries. I am Suchitra. Today's topic is photoresponsive pulsatile drug delivery systems, one of the most advanced smart drug delivery technologies in the modern pharmaceutics. In this presentation, we will understand how light can control the drug release at the right place and the right time. So we will learn the principal components, working mechanism, advantages, disadvantages, applications, future scope and the real life examples. So at the end of this video, I will also show you how to prepare a beautiful handwritten posture for this topic. So let's begin. So today's topic is photoresponsive pulsatile drug delivery system. So photoresponsive means responding to the light. So pulsatile means the drug is released in bursts only when needed. So instead of releasing the medicine continuously, so this system uses the light as a trigger to release medicine exactly when required. So learning objectives. So by the end of the today's class, you should be able to define the photoresponsive drug delivery system, explain the principle, identify the components, describe the working mechanism, differentiate the different types of light, and explain the advantages, disadvantages, applications, and the future scope. Introduction. So normally conventional tablets release the medicine continuously after administration. We already discussed about this. So but many diseases require medicines only at a specific time or at a specific organ. So continuous release may produce unnecessary side effects. So scientists therefore developed this stimuli responsive drug delivery systems. So one of these is the photoresponsive pulsatile drug delivery system, where the light act as the external stimuli. Okay, what is the stimuli here? Light. Okay, so what is it? So now let's understand the definition. So a photoresponsive pulsatile drug delivery system is a smart drug delivery system in which the light triggers drug release at the desired time and target site. So coming to the definition wise, by heart this definition as it easily. So whatever, not only this, so whatever may be the process, so just by heart this definition as it easily. Simply to say, just mug up these definitions. Definitely the definition will gives a clear cut idea about the process or about the system in a simple way. Okay, so just go through the definition. So half of the thing you will get in, so whatever may be the process, so half of the information we will get from the definition itself. Okay, so try to by heart this definition. So simply remember, the light on, the drug released, light off, the drug release stops. So this provides the excellent control over therapy. Okay, need. So why do we need this system? So because it provides on-demand drug release and targeted therapy and reduced side effects. So better patient compliance can be achieved and time-controlled drug delivery. So medicine is released only when light is applied. Okay. So principle. So now let's understand the principle. So inside the formulation is a photoresponsive polymer or hydrogel. Okay, so when light falls on the polymer, what will happen? The polymer changes its structure, so the membrane becomes permeable and the drug is released rapidly here. So when the light is removed, the membrane returns to its original state and the drug release stops here. So remember this flow. The light, when you switch on the light and the polymer changes and the membrane opens and the drug released. When the light off, drug stops. Okay, and components, there are mainly 5 important components in this formulation. That is, the drug reservoir stores the medicine obviously, and the photoresponsive polymers are hydrogels which mainly respond to the light, and the polymer membrane controls the drug release here, and fourth one is the light source. So here we will use UV light, visible or near infrared light activates the system. Okay, and the controller regulates the light intensity and duration here. Okay, so all these components work together to provide the controlled drug release. Okay, so let us see the types of light. So different types of lights are used. So like UV light, visible light, near infrared light. So first we will see about UV light. So UV light mainly provides the strong activation but has a limited tissue penetration and may damage the tissues. Okay, so visible light is safer than the UV but penetrates only superficial tissues. And third one is the near infrared light, that is NIR, that is near infrared light, so which mainly penetrates deeper into the tissues, so and is widely used in the modern research because it is safer and more effective also. So among this, NIR light is most promising for the clinical applications. Okay, and next one is the working mechanism. So let's understand the process step by step here. So first, the drug is loaded into the carrier. Initially no medicine is released. So when the light is applied externally, so the polymer changes its structure and the membrane opens and the drug comes out rapidly. Okay, when the light is switched off, what will happen? The membrane closes again and the drug release immediately stops here. So this is called on off drug release. Okay, so how it works? So observe the diagram carefully here. So before light, the drug remains inside the carrier. So after light is applied, the membrane opens and the drug particles move outside. So when the light is removed, the membrane closes again. So this makes the system highly controlled. Okay, so mechanism illustration. So this picture shows how light energy changes the internal structure of the polymer. So tiny pores are formed and the drug molecules passes through these pores here. So once light is removed, the pores closes again. So thus drug release occurs only when required. Okay, so let us see the advantages of these formulations. So there are many advantages, like they are precise drug release, dosage forms, and non-invasive treatment can be achieved by this method, and a better targeting can be seen and reduce side effects. Okay, it also have improved patient compliance and on-demand therapy useful in the chronotherapies. Okay, so these advantages make this system highly effective. Let's see the disadvantages. So some limitations are there, like light penetration into the deeper tissue is limited here. So UV light may damage the healthy tissues, and materials are expensive and the formulation is complex and the specialized light equipment is needed here. So researchers are working to overcome all these challenges. Okay, and next one is the applications. So photoresponsive systems are used in the cancer therapy, skin disorders, eye diseases, localized drug delivery, wound healing, controlled release implants. So these applications help the deliver medicines only where it is needed. Is it clear? Again, I'm telling, these applications help to deliver the medicines only where it is needed. Okay, so real life examples. So imagine a patient with a skin cancer. So doctors apply a drug loaded photoresponsive nanoparticle near the tumor. So then they shine a specific light on the tumor. So only the illuminated area releases the medicine. So healthy tissues around the tumor receives very little drug here. Okay, so this increases the treatment efficiency and reduces the side effects here. Okay, so examples. Some examples includes ejobenzene based drug delivery systems, spiropyrene hydrogels, light responsive liposomes, gold nanoparticle systems, so near infrared responsive nanocarriers. So these are widely studied in the pharmaceutical research. Okay, and a comparison. So now let's compare the different systems. So up to now what we discussed: magnetic systems, electrical systems, ultrasonic systems, and now photo responsive systems. So magnetic systems use magnetic fields, electric systems use electrical currents, ultrasonic systems use ultrasound waves, and the photoresponsive systems are using light. So all these systems provide pulsatile drug release but differ in their triggering mechanism. So this is the small comparison for all these systems, and let's see the future scope. The future of the photoresponsive drug delivery is very exciting. So scientists are developing the NIR responsive materials, smart implant activated by light, and comparison therapies using a light and a chemotherapy, and miniature wearable light devices and personalized drug delivery systems. So these technologies may revolutionize the future healthcare. Summary: let's revise the today's topic. So light acts as the external stimuli here, and the polymer responds to it, and the membrane opens, and the drug is released, light is removed, and the drug release just stops. Okay, so this is the simple flow. So this provides the precise, targeted, and the time controlled therapy. Okay, this brings us to the end of the today's presentation. I hope you clearly understood the photoresponsive pulsatile drug delivery systems. So thank you for your attention. If you have any questions, feel free to ask. Okay, so now let us prepare a beautiful handwritten posture. So take an A3 white chart paper. So write the title in the colorful sketch pens at the top. Draw a flashlight or a laser light on one side and a drug capsule on the other. So in the center, draw a capsule with a purple drug particles and the light rays falling on it. So create 4 main sections. One is for what is it, and second for principle, and third one is for how it works, and fourth one for advantages and applications. Under this, we have to mention about the definition in 3 to 4 short points in the what is it section, and draw a simple flow: light, polymer changes, membrane opens, drug released patterns in the principle. Draw 5 small pictures of drug loaded, light applied, membrane opens, drug released, and light off. So all these things in how we works section, and use simple icons for cancer therapy, eye diseases, wound healing, and targeted drug delivery. So write only 4 to 5 key points in the applications and advantages sections. Okay, so use yellow or purple for the light rays, use purple for the drug particles, and use green arrows to show the process, and keep the text short. Okay, so make the diagram large and colorful. So leave enough white spaces so the portion looks neat and attractive. Okay, so again I'm mentioning all these points here. I'm giving the small sample postures for you. Okay, so thank you for watching this video. If you found this presentation useful, please like, share, and subscribe to Medi Queries. Press the bell icon to receive the updates on more pharmacy lectures, GPAT presentation videos, and the handwritten postures and educational content. Thank you once again. See you in the next video. Happy learning.